Hi, my name is Sophia Pryor, and I'll be speaking on behalf of my fellow Texas Health Associates, Chris Mai and Aaron Belani. This semester, we had the opportunity to talk with Dr. Chan and learn all about her project on a new blood test designed to help detect liver cancer earlier. As a health associate, our main job was to perform market research in which we assumed that our market was labs. However, thanks to our mentors, Dr. Crystal Brown, Gail Page, and Christian Becker, we were able to determine that the market was actually clinicians with patients that have chronic liver diseases. By creating our business model, we determined that a blood test for early detection of liver cancer can actually save both costs and lives. Working with Dr. Chan has taught us how important it is to tailor solutions to patients to doctors who care for their patients. And with that, it is my honor to introduce Dr. Chan and her project, SpliceDx.
Thank you all for being here. I'm excited to announce our liquid biopsy approach to early liver cancer detection. SpliceDx is a collaboration between the labs of Georgia Kaplan Suarez and Ahitub at UCSF. So there are more than 40,000 new cases of liver cancer every year. We know that early detection can double the survival odds, but there's 3 existing challenges. First, the current standard of practice, which is also ultrasound screening, only finds 63% of early stage tumors. On top of that, only 1 in 4 high-risk patients with cirrhosis actually go to their biannual ultrasound screens. And that's tied to the lack of accessibility, where almost half of these patients cite some kind of barrier to going to their ultrasound screens. So our goal is to close these gaps in sensitivity, adherence, and accessibility. Our solution is a liquid biopsy approach that's built around a technology we developed called splicemers. These are biomarkers derived from cancer-specific splice junctions that can be found in patient blood. So in our pilot cohort, we found that splicemers can detect early cancer at 75% sensitivity. So this is our proof of concept that we can find splicemers in patient blood and use it to detect early liver stage cancer. So our strategy is to work with clinicians to support the existing screening workflow. So we want to give a chance to the 3 out of 4 cirrhosis patients that couldn't make it to their ultrasound appointment, but they could go to have their blood taken. So we think that with improved adherence, we could push this detection earlier for more than 3,000 patients. So why is this commercially actionable? If you look on the upper left-hand side, you can see the cost of Medicare payments in the first year after diagnosis. When you diagnose at an early stage, you can have the cost of these Medicare payments per patient. So our strategy is to have a broader reach and a strong reimbursement case by shifting care away from late-stage, high-risk, high-cost treatments. Our core value is in our splicemer biomarkers, as well as our classification algorithm. Finally, we'd like to work with existing lab networks that already have established capabilities, established networks to run our assays. They'd be able to take our splicemer biomarkers and algorithm, run it as a targeted panel, and finally return a risk score back to the clinicians. We're asking Texas Health Catalyst for non-dilutive funding to expand our validation cohort. We'd like to make SpliceDx more generalizable and robust. After that, we'd like to work with clinicians and testing sites to move this proof of concept into the clinic. So with that, I'd like to thank you all for coming, and if any of this speaks to your network or your expertise, I'm happy to connect. Thank you.
Okay, so now we can open it up to the judges if you have any questions for the couple of minutes we have allotted.
Thank you. Very great presentation. So is there any competition to your technology?
There's competition. Well, I won't name them, but there's other cell-free DNA companies out there. We have an advantage in that we don't need special sequencing platforms like methylation, etc. These splicemer biomarkers are just short sequences that you can have. If there's a low enough number, you could even do digital PCR to find them. And that's much cheaper than any of these other companies' technologies.
Great, thanks. Great presentation. Real quick, so this test is relevant for chronic liver disease patients. Can you define what that market looks like in US?
Sorry, could you repeat the last part?
This test is really targeted for chronic liver disease patients, right? Have you looked at what that market looks like?
Have we looked at?
What's the number of patients you would be eligible to get screened?
Yes,
It's widely available.
there's at least, I think, 600,000 in the United States alone with chronic liver disease, and that number is expected to rise because it's correlated with obesity and alcohol misuse. So the 3,600 number, that's a conservative measure. We're estimating at least 60% adherence to these blood tests rather than 50%.
Okay. Would this be a yearly test or once and done?
Sorry?
Would this be a yearly test or once and done sort of?
So ultrasound screens are conducted biannually because liver cancer grows very quickly, and we'd expect the same for a liquid biopsy test.